Hello, welcome to today's video, and in this we are going to showing admission module and how it works. So we've already admitted a patient and we are going to see how we can flow through the entire process of admission. So when the patient joins in, you'll take an intake form with patient, contact person details, what are their insurance details, etc. What's the personal medical history for them, surgeries, family medical history, social history, and other routines, as well as consent agreement for admitting the patient. So once all this information is filled, any comments that they want to add, then we'll go to the next one, which is after the acknowledgement it gets saved, you will generate a admission intake form. This intake form then lets you admit the patient, and once the patient is in, we'll start the care plan for the patient. Now in this case, we have a doctor tab where you have the chief complaint. So here we add the chief complaint. We add any allergies specific to the patient in the next tab. So if I go here, then you can add allergy. That's something we can add, and we can add more if there are more allergies for the patient. Then coming to the examination, we add all the other fields that you see here of its own for the doctor, where they can add like the respiratory, abdominal, intubement, color, temperature conditions, skin protein, etc. There can be a plan of care. So you can decide what is your plan of care among the SNOMED codes that we create. So one of those options will be selected. It's a search help field. When we save it, then it comes with the diagnosis plan, then the medication. So diagnosis could be so one of the specific findings in terms of coronary artery or whatever, so that you will update here. Any medication that is being prescribed by the doctor will go here and generate a prescription for that. So medical could be, as you can see here. Then coming to the next one, nursing tab. In the nursing tab, you assign a nurse, and from the nurse you provide like a support system, details, caregivers, what kind of assistance is needed, neurological, mental status, risk factors, if any, function, termination, etc. So you select the details, and you also select the specific comments section here to update if needed. Multiple of these values can be selected, but they are not mandatory. So user has to really read and select the ones that are required. Or we can make things mandatory as per the requirement of the hospital. So this is a nurse tab for the initial screening. Once this is done, we do the nutritional screening, like what's their height, weight, etc. According to them, input output chart for feeding will be created, one with the dietitian and one for the nurse. So according to the BMI, when we save it, there will be going to be an input output chart, and if there's any signs or anything that the nurse has indicated here, it will be created, and you can add another row for another date. So this is the date for today, and this gets saved. Then another day can be added. So let's say this was for 10th and this is for 14th. So for today, there could be a different nurse, and they could talk about urine, stool, and blood tests done, total intake and total output that you can update here. Then the physiotherapist, when assigned, they will have a look at the diagnosis, muscle tone, muscle strength. If there's any pain around the area and what is the improvement in terms of percentage, that's what they will update here. Same like dietitian will add their notes, and there will be a specific dietitian role for this, and they will add the kind of method of preparation, quantity, food, etc., or any restriction in the diet that they need. From investigation standpoints, we can add like multiple tests and screenings, and the test will be the test that exists in your setup, or you can refer additional laboratory tests as required. So these are the tests from the setup which you can add. So I'll just add island studies here. It's still pending, so it creates a lab generation report, and now you have to go to the lab module to be able to generate that report. Then during the surgery, if there's any surgery, you can add a list of your own checklist, but this is a surgical specific checklist, operation notes, and post sedation recovery score sheet. So all those will be assigned to a particular doctor, to the same doctor or to a different doctor. And depending on who the doctor is, they also need to sign once they update these checklist information, as you can see here. And same, they have to select a particular doctor to sign for the post sedation and operation notes, and any remarks can be added here. So once this is updated, we go to the operation note, surgical notes, as well as post sedation recovery, and add the name of the doctor again for them to sign. Yeah, so here we add the doctor signature and operation sedation notes. So once this is updated, then if there's any follow-up, and the billing items get automatically added based on the test reports generated based on the admission and the different doctor, nurses, etc., as well as the admission daily rates, the billing tab will be updated accordingly. The current setup works, and if any upload documents, checklists, etc., that needs to be sent to the patient, it should be updated here, and it will all be part of the transfer or discharge process. The user can then be marked as serious, stable, unstable every time you update, every day when you update a screening for the patient. And during discharge, all these notes together will be used to create like a discharge checklist along with the instructions and sign from the doctor. Discharge checklist again can be pre-configured, and it can have more details. Right now it's a simple checklist option, but this can have a Word, PDF, etc. attached to it. And based on that, the user can do discharge notes, current instructions, look at the billing summary. If all the billings are settled, there's nothing unpaid, then it will allow the patient to be discharged. So currently, the outstanding bills have already been cleared out. The only payment pending is the one that you see here, because I just added an island studies one. And that's about it. In the summary, we will see all these things together: component, name of the operations, etc. If any surgery done, then that list of investigations that was provided, and the whole discharge checklist. So once this outstanding bill is clear, discharge will be enabled and the patient will be able to be discharged. So that's about it for today. Thank you for watching, and please let us know if you are interested in discussing our modules further, and we are happy to customize according to the business requirement, and that helps us to make the product better each time. Thank you so much.